In vitro fertilization is a treatment that involves fertility drugs given in a time period of 8 to 10 days to the patient to stimulate follicle growth and multiple follicle growth. Patients are usually seen on day 1, 3, 6, and 8 of the stimulation cycle. Many different types of drugs are given to thicken the uterine lining, to grow the follicle, to block the follicle from being lost. And bottom line is, once we get to the mature size of a follicle and the hormone levels are within a normal range, we then give a trigger shot, and 34 to 36 hours later, we do a procedure under IV sedation in the operating room where we retrieve the eggs, called aspiration or follicle aspiration under ultrasound guidance. This completes the first part of in vitro fertilization. That means stimulation and retrieval of the egg. The patient wakes up, we tell them how many eggs we got. Immediately we tell them how many were good quality, poor quality, or excellent quality. And that's the day that we either add sperm to the egg in the lab, or we actually inject sperm into the egg. Once that's done, the embryos are then observed over a 3 to 5 day period in the laboratory, and we monitor their growth, the rate of growth, the degree of fragmentation, outer shell thickness. The embryos, once they have reached the stage that we want them to, are then placed into the uterine cavity by a procedure called embryo transfer, which is done under ultrasound guidance.